Dr. Anthony Harper here, blessed to be at the Hadassah Hospital here in Jerusalem, Israel, with Barbara Sofer, and you are very familiar with the hospital. What is your role here?
I'm the Israel Director of Public Relations for the women in the United States who built this hospital, who created the healthcare system of of Israel, and who still support it. They're called Hadassah, the Women's Zionist Organization of America. The 300,000 volunteers who support Israel, and particularly this amazing medical center, which is considered one of the top medical centers in the world, dealing with both treatment and research, coming up with new ideas to save lives not only for the people of Israel, but for the whole world.
Okay, a very special place here. And regarding those that would criticize Israel for being an apartheid state, what would you say to them, also in light of the Arab people receiving medical help, even the terrorists?
I would say that anyone who dares to call Israel an apartheid state should see a psychiatrist, that we are totally integrated. We are in a hospital where both staff and patients are exactly equal. We have department heads who are Arabs and department heads who are Jews. We have patients, as you can see, in every department, in every waiting room, in every surgical place that we have here. We have very advanced facilities. The patients are mixed as well. The only way you can see that they're different is that they tie their headscarves differently. In Jerusalem, religious Jews, religious Christians, religious Muslims here. This is a religious city, also a city plagued by terrorism. And here we treat everyone, and the politics stop at the door. The only enemy we have is a disease, and here, when we have a terror attack, we have a team of Jews and Arabs working together. It sounds crazy, but that's the way we do it here. We have a mixed team dealing with we have terror victims. We've had more terror victims than any other hospital, certainly in Israel, and we treat them, children, women, men, and when we have to, we treat the terrorists as well. So that we've kind of become a model for the hospitals of the world, particularly, I would think, in the United States, but also who are dealing with this plague of terrorism, who have to deal both with the terrorists and the terror victims, and staff who have a hard time dealing with that. But we have an amazing staff. We say that this is an island of sanity, not just for Israel, but for the whole world, where you can see the values, our biblical values, are that go back always to the creation of this hospital, and every single day we have patients here from the Gaza Strip, we have patients here from the cities like Jenin, which was the heart of terrorism, and Hebron. It doesn't matter. People come from the most anti-Israel area, and they say, well, look at that waiting room. You have Jews and Arabs and those religious guys with the long hair, and we call them peot, and they're all sitting. I say, yeah, they're waiting for the hand surgeon. And I say, believe me, I didn't go to central casting. These are our patients, day in, day out. And we're proud to be able to do that, and to maintain our values, and to be searching for the answers to the hardest questions. We have 2 teams working on ALS here. We have teams doing research with cancer. We have something called organoids, where medicines can be tested in a test tube instead of on the person, people who are going through cancer treatments. We're the only hospital in the world where, for back surgery, you don't have to be put out. You can do it, they do it when you're awake. We're breaking the bounds of what medicine can possibly do. At the same time, we were nominated for the Nobel Peace Prize because we are able to deal in Jerusalem with the most complex medical problems, and I would say the complex human problems as well.
For more information about Hadassah Hospital, people can, of course, easily go to the internet. Invite you to learn more about Hadassah Hospital. There is an organization that is funding that helping with the Hadassah Hospital. That organization name again is?
Hadassah, the Women's Zionist Organization of America. We're proud to be Zionists, to support the State of Israel. And we're a women's organization. We know that women's health isn't always the focus of research, and here we are stepping forward in the areas for mothers, for grandmothers, for young women, all of whom want to have a healthy future.
Okay. Well, I wanted to say to those that are watching this, I am an eyewitness here at the Hadassah Hospital. I've seen Arab patients here, Jewish patients, people from all different walks of life are getting help here. So I disagree with those that would call Israel an apartheid state. The Jewish people are showing love towards their enemies, and I see that played out here at the hospital. And thank you for joining me.
It's my pleasure, and I'm so happy to have you see with your own eyes what the truth is.
My name is Dati Yitzhaki. I was found with cancer, stage 4, completely in the whole body, 17 years ago. And I came here to Hadassah to get treatment, and thank God I'm alive. Mm-hmm. And unfortunately, it's second round. I found it a month and a half ago. So I came back to Hadassah, and I hope at least another 17 years to be here.
Well, I pray so as well. You know, for those that would criticize Israel as being an apartheid state, how do we see, the treatment of Arabs here versus the Jewish people? What would you say to people that accuse Israel of being apartheid?
People accuse Israel with no reason. They just do it. I think the problem is that they don't know the facts. And if you look on it, especially here in Hadassah, a very big portion of the people that are treated are Arabs. The doctors are Arabs. I don't think anybody feels anything about it. Mm-hmm. Israel as a country, except all its citizens. Just yesterday night, they were talking about what kids achieve in high schools, schools of Druzim. The Druzim people are first class. They get the best education. They serve in the army. I don't think there's such a difference.
Thank you for sharing your story here, and thank you for checking out more information at Hadassah Hospital here in Jerusalem, Israel. Wish you the best. God bless you with good health.
Thank you. A lot of health for everybody, and I hope to be here many more years.
I pray so as well.
So my name is Ahmad Nama, Dr. Ahmad Nama. I am the head of the emergency department at this hospital. We are, as you know, we are a tertiary medical center, referral center. Our emergency department, we see around 100,000 patients per year. So this is roughly an average somewhere between 320 patients, depending on the day. This is our numbers.
There are Arab doctors here, there are Arab patients, and you're even treating, from what I understand, there are patients here that have been terrorists as well, that they receive help.
So first of all, this is a special place in many aspects, mm-hmm. but we have to understand that we give the percentage of patients that they come here as in their background, Arabs, Jews, different religions, Christians, mm-hmm. they reflect the population, the structure of the population. What is definitely the case is we don't really distinguish, or we don't really care who's coming here. Patients are patients. We give mm-hmm. treatment for every single patient that they walk to these doors. This is, by the way, our oath as doctors and nurses. But this is you can see these things happening here at this hospital because we are, you are in the Holy Land, you are in the middle of a very big conflict. But this conflict definitely doesn't have any place in between these walls. Patients walk here. Our doors are open 24/7. Whoever enter these doors, we are here just basically to treat these patients, regardless their background. And one more important thing, the people here that they give treatment, they are also in a different backgrounds. So we are a mixture of Jews, Arabs, and we have also some international fellows that they work here. This is a mixture of the patients, mixture of the treating staff, and this is how we live.
Well, thank you for sharing here.
Thank you.
I invite everyone, of course, to pray for the peace of Jerusalem here, pray for everyone here at the Hadassah Hospital, and for Israel in this very difficult time. We want to encourage you and everyone here and pray for blessings for good health for everyone here.
Thank you.
Well, I'm the director of the Division of Pediatric Endocrinology in both Hadassah hospitals. I'm a consultant also in the pediatric department, and I'm the chair of pediatric studies in the Hebrew University of Jerusalem Medical School.
Okay, what is the breakdown about the patients here as far as Arab versus Druze versus Jewish?
In Jerusalem, we have about 50% of our patient population are Arabs, Palestinians that are mostly Muslim. Most of them are residents of Jerusalem and the area. There are some of them that come also from the West Bank or from the Palestinian Authority, and we see all of them. It's not only the patients. We are responsible for the training in our field of pediatric endocrinology of all the pediatric doctors in endocrinology that practice now in the Palestinian Authority. Moreover, they come every week to a meeting with us. They present, they take part in our studies, in our research, and they present with us in international meetings. For example, tonight we are flying to Rome to the European Society of Pediatric Endocrinology meeting, an annual meeting, and there are three that are presenting, Palestinians, that are presenting in the name of Hadassah and their hospitals.
Okay. You know, for those that really are very critical about Israel and call Israel an apartheid state, what would you say to those people? Because, because you're helping Arab and different other religions here and even treating the terrorists. So what would you say to those that accuse Israel of this?
Well, this has absolutely no base. Definitely in this hospital, you can go into corridors, you see all of us together, Orthodox Jews and Orthodox Arabs and Orthodox Christians. As I said, the patient population is clear, but as I just mentioned now, it's not only the patient population, but it is the staff population, and not just the staff, that there are nurses or so. These are people that are with us on the front line of the world in endocrinology. They are with us, parallel to us, researching with us, treating with us, and obviously the patients. And when you see the patient population also today, in my clinic today, there were 4 Palestinians and 4 Jewish patients. So I can't see any claim for apartheid. We live together, we do everything together. Parties of the division are together, they all attend. I don't see I don't know where this question comes from, because this is our everyday life.
And as I've asked before, for people to pray for everyone here at the hospital, and thank you for sharing today about the experiences.
You're welcome.
Okay, thank you.
Mm-hmm.
Appreciate it.
Our arms are outstretched, and we invite you to come to visit, to see with your own eyes, to be an eyewitness to the wonders that happen here. And I'm so glad to have you here to see some of them.
It's a blessing to be here in Jerusalem at Hadassah Hospital. Thank you for joining us. Pray for the peace of Jerusalem. Pray for everyone here at Hadassah Hospital. Thank you, Barbara.